Okay. And then I can cover the other nostril.
There we go. I don't know what that is. Closed.
All right, so then if we were going to test visual acuity, then you could use the eye chart or something like that. But we're not really gonna get into that too much. All right, so now I'm going to test visual acuity. So let's have you cover this up, cover this. Okay, and then I want you to keep looking straight ahead. Keep looking at my finger right here, and then I want you to tell me when you see my finger coming up from the side. How many fingers am I holding? Okay. And then now tell me when you can see something from the top. Okay, so then you can just map that out and see exactly where, and then you do the same thing to the other side. And then now, no, you don't need to cover it. I want you to follow my finger with your eyes, don't move your head. Okay, so basically you want to test like 6 different directions, or actually 8. So up and down, side to side, and then the 2 diagonals. So you're just basically going up like this, and then you can sort of do like a figure 8. And you want to watch and make sure that her eyes can follow that. And I can't get on the internet, but if you go onto that site, you can check and see people doing it with abnormal findings. And you can actually, they'll do it like this, where they have one side covered and they'll check, they'll check one eye at a time. Okay. So then that's second cranial nerve, actually 3rd, 4th, and 6th. Okay. So that's, and then some of those you're checking. Notice you're checking the second, if they can actually see, of course. And then you're going to check visual fields, to check and see, because that could be damaged with the optic nerve if they can't see in certain areas. Okay? So when you're checking visual fields, you're pretty much doing that for the second cranial nerve. Okay? So when you practice doing those, and then you go from there. And then, like I mentioned, if you go to you're comparing the equal movements, the eye should move equally, and then if you go to lateral gaze like that, you're looking for nystagmus, where the eye is going to shake back and forth. Okay, so you can have the stipular nystagmus, which is horizontal like this, or you can have vertical nystagmus. That's the worst one, up and down. And then pupillary reflex, if you look, you can see on the video there, when you shine light into the eye, it's going to constrict. Okay? And then there's also a way that you do it if you have something covering between the 2 eyes, like something like this. And if you shine light in one eye, it should also affect the pupil on the other side. So, because like it says on here, when you shine a light in one eye, it goes back into the brain, and then also it transfers that pupillary constriction to the other eye too. So when you're checking pupils, you check one eye at a time, and if you put something to block the light in between, you should see the other one constrict. And then there's something called Horner syndrome, where basically there's ptosis of the eye, and then on the side where the pupil's smaller. So you can see on this side, the eyelid is drooped and the pupil's a little bit smaller on that side. But then the reflex and accommodation would be normal. Okay, so you can read the stuff there where you're checking, and what can cause Horner syndrome is like you can have a tumor in the apex of the lung that can affect the nerves going to the eye, where you can have the drooping of the eyelid. And then if you have bilateral dilated pupils, then you can have swelling in the brain, brain trauma, so that's a bad sign. Because when they talk about people, they examining people in the emergency room or something, they say pupils are equal and reactive, so meaning that they're both the same and they both react to light. Okay, so if you don't have that, then you got problems. If they're both small and they're not reacting to light. So then you have terms for pupillary constriction, so meiosis, and that's done with the parasympathetic system, and then mydriasis, which is pupillary dilation, which is sympathetic. The sympathetic, again, is like your flight kind of system where your body's amped up and it needs to act, so you want your pupils to be open so you can see as much, where parasympathetic is going to constrict it. So miotic pupils can be caused by alcohol and barbiturates, and then other things can cause dilated pupils or mydriasis. So different other kinds of drugs, marijuana, ecstasy, LSD, that kind of stuff. Then you can have Horner syndrome. So that's damage to the sympathetic nervous system. Right, so then if it's damage to the sympathetic nervous system, are your pupils going to be dilated or constricted? Constricted, because the sympathetic nervous system is what's going to dilate them, so if it's not working, they're going to be constricted. And then it's usually affecting it on one side, so you have ipsilateromyosis, ipsilateroptosis, ipsilateroanhydrosis. What does anhydrosis mean? Well, in this case, yeah.
Fluid?
Yeah, probably dryness of the eye. And then blood vessels on the corresponding side of the face and head become dilated as well. So you can see this side, it's going to be having a little bit more constricted pupil, the eyelid is dropped. And then strabismus is going to be deviation of one eye or the other. Like if somebody's eyes aren't both pointed straight ahead, like if one's off to the side. So that could be damage of one of the muscles of the eye or one of the cranial nerves that affect the eye muscles. Okay. Sometimes people can have congenitally shortened eye muscles, so their eyes are skewed off. Where we would see that is if they can move their eyes normally, but it's just permanently off to one side, then that may just be a congenitally shortened muscle. But if they're not able to follow and track, if they're not able to move the eye, then that's a sign that there's a problem with the nerve or the muscle. So diplopia again is going to be double vision, so you could have it either in one eye or in both. So if somebody has double vision with both eyes open and then it closed and they cover one eye or close one eye and it goes away, then that's going to be the binocular dioptry. And then again, like I mentioned before, if their eyes are deviated, they may accommodate it by tilting the head or something. So what might appear to be a neck problem could actually be a problem with the eyes. Internuclear ophthalmalgia. Okay, so that's the problem with multiple sclerosis, where it's affecting the medial longitudinal fasciculus. Remember, fasciculus is what attracts on the spinal cord. So basically, their inability to abduct the eye on one side, on the side of the lesion. Okay, so they're not able to move the eye out to the side, and then they're going to have nystagmus of that eye. But they can converge in like that. So basically, that would be affecting the motor to the muscle to the abducens nerve, which abducts the eye. So now, if somebody's pupils are normal and reactive, right, that